that's a pretty gigantic, huge, big, gigantic, I don't know what other word to use, piece or pieces of dental tartar. If you're new to the channel, my name is Dr. Mo and I'm a dentist. Today, I'm not gonna only address how does a person reach a case like this, which is more common than you may think. You may think, oh, well, no, that's too severe, it's too rare. Not really. There's actually a lot of people that are having this much tartar, this much plaque accumulated. Now, someone may say, well, intuitively, plaque will just, and dental tartar will accumulate over time. That's what happened. But there's actually more, a lot of things involved in this. Not only this, it's not only a matter of sheer amount of dental tartar accumulating on teeth, but there's a lot of things in relation to the biology of the gums and biology of the rest of the body that's being very, very heavily negatively impacted by this. Okay, trust me, I have actually seen cases like this in person. Can you imagine? So unfortunately, somebody may come to the dental clinic and they may have neglected their oral health for a long period of time. Often also they're a heavy smoker. It's not necessary for someone to be a heavy smoker to reach a case like this, but even smoking itself is bad for the gums, and something called as periodontal health, right? Which is things in relation to the gums, the underlying supporting bone, etc. Now, of course, a case like this is more on the severe when you look at the spectrum, like normal to abnormal to severely abnormal. This is, of course, more towards the severely abnormal. But that doesn't mean that it's very uncommon. There's actually a lot of people with similar amounts of dental tartar. So this is pertinent not only does not brush on a regular basis, does not floss on a regular basis. I know there are some angry people online that may tell you negatively things in relation to dental floss. Well, how else are you going to clean in between the teeth? There are other means of what we call them interdental cleaning, meaning cleaning in between the teeth, and these could be things like interdental brushes or other methods of interdental cleaning. Water flossers, okay, are also emerging in order to clean in between the teeth. Okay, so the way this video goes is I'm going to talk about also what are the risks of having something like this and leaving it untreated. Now, a lot of people could be developing like a lot of dental tartar over time and they're not even feeling much. That's the scariest part about this. Okay, I don't want to scare people, but they could be having a lot of dental plaque, dental tartar, some of it even, like, look at the teeth from the outside. You cannot see as much of the dental tartar and plaque, but when you look at the inside, this view is like looking from above. Okay, so when you look at the inside of the teeth, or the side that's more toward the tongue, right, we call it actual lingual side or surface, you're going to see more dental plaque, more dental tartar being accumulated. There's a lot of reasons why it accumulates there. A lot of people, they brush their teeth. Sometimes they may forget or may neglect the inner part of their teeth. This also happens often in the areas of the molars, okay, in the way back. Why? So because people may brush their teeth, they brush everywhere, then they forget or they ignore the molars, okay, they ignore the molar region, and that's also very bad in relation to oral health, in relation to dental tartar buildup, and so forth. So far, we're talking about oral hygiene factors, not only brushing and flossing. So some people may say, well, although they brush, but they still develop dental tartar and stuff. Okay, well, what's happening is they may be brushing, quote unquote, brushing, but are they brushing properly? Are they using the correct toothbrush type or toothbrush technique or brushing technique? Okay, happy to meet you. Right, so they could be using very wrong brushing technique. They may be So some people can be cleaning their teeth, but they're brushing too aggressively, so they're kind of also harming the teeth. They may be using very hard toothbrush. It's also can be harmful for the teeth surface itself, especially if it's being used aggressively. So it's very important not only to brush, but also to brush properly as well, to avoid ending up in a case like this. Okay. So these are things in relation to oral hygiene. So some people could be also, let's say someone brushed in the morning, then they ignored brushing teeth throughout the entire day, and then they slept also without brushing before sleeping. Well, technically they brushed in the morning, but they had the entire day worth of food and all stuff stuck in between their teeth and on their teeth and inside also the mouth and other places that weren't really clean later on. That's why brushing also some time before sleeping is also very important, because you just finished the whole day, so that's a time to brush your teeth. Okay, some things may sound logical or intuitive, but some people don't do them. Okay, just like the very basic things for health, such as sleeping well, exercising, etc., eating well. Well, yeah, these are very simple things, but do a lot of people do them? There's a question mark there. So this is in relation to oral hygiene. Are there other things that we may need to look at? When you look at the evidence in relation to medical health as well, of course, this very heavily impacts in a negative way overall health and medical health. People with gum disease, people with periodontal disease, you can do your own research, please, in relation to that and overall health. People who are also diabetic, that are at risk to having periodontal disease. So you look at diabetes, dental plaque, dental calculus, gum disease, periodontal disease, you'll get a better idea. It's very easy to research these things now with there's a lot of really reputable articles out there. You can have a look at them. So we're no longer looking at the mouth and teeth and the gums only, but it's also important, how does something like this impact the rest of the human body. Okay, so oral health should be taken into serious consideration. Regular visits and checkups with the dentist are very important, in my opinion. Of course, it's for educational purposes and it's not medical advice. Also, it's very important for everybody to like and share this with their friends. This is something with the YouTube algorithm is very important. Okay, so what else we're going to dive deep into? So this is in relation to oral hygiene, regular checkups with the dentist. So far, let's say these two things are ironically checked. We talked a little bit about medical health. How's the medical health of that person doing? Is it deteriorating? Are they young? Are they old? How long did they have periodontal or gum disease? We also check the health of the gums, or we do a full assessment of the mouth and teeth and the gums as well. We have something called as periodontal probe. With regard to periodontal disease itself, there are different stages and grades as well. You can check, there's a table summary about this. You can find it easily online. Okay, so what are other things that we may need to take into consideration? Okay, with regard to the management, of course, cannot generalize for multiple cases, but definitely cleaning of the teeth will be involved. And also, we need to check the gums and other, like thorough medical dental history. Are there any infections? Is there any fever, any pain? We look at the X-ray investigations. Why is X-ray important? Someone may ask. Well, we look at also the teeth roots, the bone level. So it gives us an idea. Welcome everyone who joined, Bridget, Jonas, so Tartar. I'm just getting into, because I need to get a lot of things out. Very important for people who are going to watch this. So oral hygiene, checkups with the dentist, medical health, medical consequences of having something like this. Okay, so get an idea. There's a lot of things we need to go through. I mean, medication, of course, subject to the healthcare professionals' assessment and judgment. I didn't during my practice. Really, I prescribe medication when it's necessary. I see maybe I think some healthcare professionals should be a little bit careful when it comes to prescription, even of basic antibiotics. If it's necessary and indicated, then fine. But other cases, they need to be careful, and I also myself need to be careful, very mindful rather than careful when it comes to prescription of antibiotics and even other medications. Okay, so what else? So dental floss, water floss, oral hygiene. We talked about medical health, medication, of course, checkup, seeing dentists, seeing specialists. Also, there's some a specialist called as periodontists who dedicate their entire time for things like this, and of course, other cases too. Also, so other than Plaque Tartar, of course, there's crowding there. The whole thing is a bit messy. I mean, it's a mess, to be honest. But I mean, even if it's on the severe later stages of periodontal disease, there's still healthcare professionals intervention in a case like this. Urgent healthcare professionals intervention can be helpful to help manage this as soon as possible, because over time it just gets worse. Problem with periodontal disease is that it can be with pain, and with some people the pain could be so subtle or not very clear or evident that they may keep on delaying and just keeping on ignoring things. No worries, my friend. I don't know how many accounts you have. You have so many accounts. It's all good. Okay, everyone. So I I think we covered a lot of things. Okay, so we also other things that we check, not only the x-rays to look at bone level, and there are other ratios and stuff that we actually look at. It's not only bone level and bone condition. Even a two-dimensional x-ray can be very useful in providing information when we assess a case like this, to be fully honest with you. Also, it gives an idea that after all the downscaling, the clinics necessary, the gum treatment, after all of that, like the X-rays helps us not only in assessment but in future planning on what to do next after something like this happen. Now, this person also looks like they have crowding, so that needs to be addressed and managed at some point too. Okay. Some people may be surprised. Not really surprising. There's a lot of people with a case like this. When I was in university, there are people who have a lot of dental tartar, a lot of dental plaque. That come for help. It's good. I think it's a good sign that people like this would have the courage to go to a dentist or dental hygienist or specialist to seek help. I think that's very good thing. Okay, so there are other things such as the tooth mobility is also checked, meaning are those teeth stable in place or do they have some sort of mobility? There are different grades of mobility going like from mild to more to moderate to more severe. Mobility, unfortunately, if the tooth mobility is very high and the tooth is too loose, it could be too late to save the tooth. Could be far more challenging. The less tooth mobility, the better, meaning the more stable the tooth is in place, the better. That's why we also look at the bone level. If the bone level was too low or there was a lot of bone loss, then people need to know that fortunately that case most probably reaching more later stages of bone loss and most probably periodontal disease. There's also something called as perioendo lesion. Endo in relation to the inside of the tooth itself. So if periodontal disease could advance to a point where it start also affecting the actual tooth itself from the inside, so that's called the perioendo lesion, perioendo disease.